you drink alcohol as a diabetic? If so, what is a safe amount?
Well, there's no reason why you can't, because you're living the same as everyone else. You just have to be aware of a few risks. And one is, if you, for example, drink alcohol, it means our liver is going to be busy many hours after you drink alcohol because it's a toxin. The body wants to get rid of it. So the liver, it's not so good at multitasking. So if you're, for example, taking insulin or a medication like glycoside like a sulfonylurea family of medications, many hours after you drink, say you had a drink with dinner, you might have lower blood glucose, say at about 2:30 or 3 a.m. And that's not a nice thing to happen because you're asleep, and it might wake you up, or you might just go really low in your sleep. So being careful about how much alcohol you drink is really important, and not counting the carb associated with the drink. So if you had a beer, you wouldn't count the carb in the beer. Ideally, look for lower alcohol drinks, and you can still enjoy the drink then, and it has less effect on the blood glucose levels later on. If you the general guidelines for drinking alcohol for Australians are to have no more than 10 standard drinks per week, and no more than 4 standard drinks on any one day, because more than that is considered binge drinking. And our average drink, like a wine glass, a little wine glass, is 150 mils of wine. So that's actually 1.5 standard drinks. So an average bottle of wine will have 7 or 8 glasses, standard drinks in it. It will say on the bottle how many standard drinks there are. So what we consider a drink isn't the same as a standard alcoholic drink. Alcohol also adds kilojoules. It's not just the kilojoules in the flavourings of the drink, but it's the actual alcohol content has kilojoules. So if you're battling a spare tyre and trying to reduce your insulin resistance with, for example, type 2 diabetes, then maybe cutting back on alcohol is the way to go. But, do enjoy it if you do drink it, just don't overdo it. Have someone with you who knows you have diabetes, and have someone with you if you're possibly likely to have a hypo, have someone who knows how to treat a hypo.